The following portion of Daytime Tri-Cities is sponsored by SFG Medicare.
Well, on today's Medicare Tips with Andrew, we're going to compare the pros and cons of employer coverage with Medicare plans. Certainly a lot to talk about this morning. Andrew, good to have you back on Daytime.
Always glad to be here.
So we're talking about this situation where if someone still has the option of employer coverage but also qualifies for Medicare.
So the biggest thing is if someone is working or a spouse is working and they're offered employer coverage, they actually don't have to go on to Medicare.
Okay, but then would they have a penalty when it comes to, I know sometimes Medicare can have penalties.
Right, so that's what everyone's always scared of. So as long as they're working or a spouse is working, then they do not have the penalty for not signing up with Medicare.
So when would Medicare be better than the employee coverage?
So in most cases, even though they're offered insurance, Medicare is going to be less expensive monthly and actually better coverage than their employer plan. So even though they don't have to go on to Medicare, 9 times out of 10, I see that people are better off dropping their employer coverage and actually going on to Medicare.
So obviously it would be cheaper. Is the coverage still comparable?
So that's the thing, is the coverage is usually better. So one, Medicare, or not Medicare, but health insurance costs are going up. And so that means employer costs are going up as well. So Medicare only costs about $175 for Medicare Part B, and then the extra plans usually don't cost anything. So they're usually cheaper monthly, but then also the benefits are better. So most employer plans have high deductibles. You know, they have $3,000, $4,000, $6,000 deductibles. Most of the Medicare plans don't have deductibles. All they have is small copays.
So how do they work then if they don't have a deductible?
So a deductible means that the person has to pay, say, $3,000 before the insurance company pays anything. So let's say you have to have an MRI. Now let's say the MRI is $1,200. Then you're paying $1,200 for that MRI because you haven't met your $3,000 deductible yet. Well, with a Medicare plan that doesn't have a deductible and just have small copays, the copay may only be $100 or $200.
So that certainly sounds a lot better.
Yes, so in most cases, like I said, a Medicare plan is going to be less expensive and then better coverage than what you could get through an employer.
So if someone's over 65 or under 65, can they go on this plan?
Yes. So you can actually do that anytime. You don't have to wait for an enrollment period because the employer coverage costs the employer a lot of money. So the employers actually want people that are 65 and older to drop off the group coverage and actually go on to Medicare. So it's kind of a win-win situation. And Medicare allows you to enroll into Medicare anytime if you're losing your employer coverage. So, you know, we're in May. You know, you could set everything up for, say, June the 1st or July the 1st to drop off your employer coverage, have your Medicare start.
And you could actually help with that service.
I can help with a lot of it. To apply for Medicare, you have to do that through the Social Security office. So you could do it in person, you can do it over the phone, or you can do it online. But I can help advise them through that and then pick all the other plans.
Anything people should know about the employee plan?
Well, the biggest confusion is people are uneducated. People just assume, okay, well, I'm working, I don't need Medicare. And so that's a lot of why I do what I do, is help people, you know, walk through that, talk it through them so that they're educated on what options they have and what's best for their individual situation.
And it sounds like that could be the better route for them.
For a lot of people, it is.
Yeah. All right, well, we're going to give everybody some information. If you have other questions or you would like to ask Andrew, you can always get a hold of him at that number right there that is on your screen, 737-1865. Andrew, thanks so much for being with us today.
Thanks for having me.
The preceding portion of Daytime Tri-Cities was sponsored by SFG Medicare.